Before we get started, let me just go ahead and say a couple of things real quick. You might notice a few changes over the next several weeks, I would say, with where and how things are done. But as those things happen, we will communicate those to you. So, for example, where we put things or um, a certain way to do something, or if you need a special contract to be able to sell a specific product, you might be reached out to directly to get that contract in. So there are a few things that need to happen. And for those of you that it needs to happen with, we will reach out to you. Outside of that, if it's a general thing that's going to happen, we will definitely communicate it through our normal channels, which usually means that we'll send out through MailChimp, which means you'll probably get one, maybe two emails explaining what's going on. Nothing super serious. Just want to make you guys aware that you might be receiving some communication, so don't disregard it because it might be important. So with that being said, today's training, we're going to talk about how to get the most out of your broker managers and really what their purpose is at this time of year, right? So we have passed OEP, which is open enrollment period, which for lack of better terms is what I like to call the uh-oh period, right? So when people realize from annual enrollment period that they have gone into a plan that is not the best fit for them, OEP was designed to allow them to make a one-time change into a better plan that better suits their needs or better suits their needs. So now we have gone out of that. We are now into the fourth month of the year, which is considered rest of year. So from now until actually the end of year, but most likely until October, we will be focusing on some specific populations, right? In the last training that I did, which was a couple of weeks ago, we talked about looking at low income, we talked about looking at people who have special needs, and we talked about people who are turning 65, right? So this training is how to get the most out of your broker managers. So depending on how many carriers, which when I say carrier, that would be a company that offers a product like Humana or United or Aetna or whoever. However many carriers you are set up with, if you are not trying to grow that, this may be a good time for you to do that. And if you are, what I'm going to do is ask you to send me a text message, right? Which let me go ahead and set up my chat so that you guys will all have my phone number. That's my mobile number. For those of you that have already used it, you know, if I'm not busy, I answer that phone. For those of you that shoot me text messages, I always respond, right? So if you're interested in growing your portfolio of Medicare products, which I always encourage you to do, you always want to have more than less. And especially with the way that I teach you as brokers, you always want to have what the client needs, right? So what that does is it does two things. One is it allows you to always say to your client with full transparency that I have everything that you could possibly need. And so that I can take care of anything concerning Medicare, whether it be your prescription drug plan, if you're getting a supplement, which I can do both of those. I can do Medicare Advantage, and I can do that through any company, right? So I know we started out things saying, hey, get at least two, maybe three companies, but now, you know, since the first of the year would be the time where we need to grow that. So if you have areas that you need to grow as far as contracting, please reach out to me before you do that. I'd like to have a conversation with you about a strategic plan on how to do that. and then we can go from there. So that brings it to the second thing, which is the use of your broker managers, right? First of all, let me explain what their job is. The job of a broker manager is to make sure that both captive agents, which means that agents that work for that particular company, as well as broker agents, which is what you are considered, are successful, right? And so what they are able to do is sometimes a lot more than what we can do as your upline, right? They can schedule seminars and do advertising for it. They can have promotional items that they give out or give to you to give out for free, to draw people into these seminars, right? So the goal of the broker manager is to make sure that you succeed, obviously with their company, but in general, as a broker, we take advantage of their hospitality in what they can do for us. Sometimes that comes across as something as simple as attending a seminar, and whoever needs to sign up can sign up, right? Again, this time of year, we would like to focus on three main groups: people turning 65, people who have chronic illnesses that would be able to join a chronic plan in your area, and people who have low income. So broker managers are really good at getting things like that taken care of, from the seminar side of things, right? But if you don't communicate with them, guess what's not going to happen? They're not going to use you. So one of the things that we need to do is make sure that your lines of communication with your broker managers for your different companies that you're contracted with are open, right? And you're communicating with them that, hey, look, this is my first year, or this is how long I've been doing Medicare, and I would really like to continue working with people throughout the rest of the year, where most agents are taking this time off, right? So it shows that you're a go-getter and a person that they can turn to, because their job is to continually grow their growth of their product throughout the year. Now, as brokers, we're going to come across situations where, let's say, United Healthcare hosts a seminar for us. And as we sit down with people, we're still going to do our 4 pages, right? And we're going to find that United Healthcare is not the exact product that we want to put them in or that they want to go into. And that's okay, right? We're going to schedule a second meeting with them and sign them up with the right product. So just because a specific company hosts a seminar doesn't mean that you have to write that product, right? Obviously, the broker managers would love for you to do that. However, you'll find that if that product is not right for that client, your broker manager is not going to get mad at you for putting them in a different plan. Now, you wouldn't want to do that at that venue, but they're not going to get mad at you, because what eventually would end up happening is if that client is unhappy with that plan, they're either going to call CMS or they're going to call somebody and they're going to complain, right? And so that complaint will go against the company, but it'll also go against you. And nobody wants that to happen, right? The company doesn't want a complaint to come against them. And of course, as agents, we don't want complaints to come against us. So broker managers understand that concept, especially if they've been working in that position for a while, right? So again, I just want to emphasize that if you do have a seminar that they set up, don't feel like you have to sell their product. You want to do the right thing by the client, which means you do a needs assessment. You make sure that their doctors are all inside of one plan. And if they're not, then you make sure you put them into the right type of plan, which would probably be a PPO or a supplement, and have them drive forward, right? Making sure you're taking care of their needs. So that's one big thing that broker managers do, is that they set up things either like that, or they give you leads, right? In case you haven't noticed, ads for Medicare products have not stopped. They're not as frequent as they were during open enrollment, right? During AEP, they slam the televisions, right? Matter of fact, I think Humana has 20 out of 24 hours on one channel, right? So it's basically like the Humana channel for Medicare Advantage. But if you are not just a subscriber to Hulu and Netflix and stuff like that, you actually watch TV. They have kind of converted some of how they do their marketing. There's a better mix of Medicare supplements and Medicare Advantage that are out there. But every plan is still marketing, right? Which means that they're getting leads. Now, to be transparent, most of those leads go to captive agents, the agents that work directly for that company. But you will find that there are overflow of leads for almost every company, right? And so the closer you are to your broker manager, the better chance you have to get those leads assigned to you, right? I'll give you, for example, Cigna Healthcare. Um, they have a they have a tracking system on how they do their leads. So let's say a lead comes in, somebody called the 800 number because they wanted more information on a Cigna plan, right? Because they saw that ad on TV. So that will go into a queue. That queue has to be worked on within a certain period of time, 24 to 72 hours, right? If it is not worked on by that period of time, it gets reassigned to someone else, and then it's first available. So if you're the person who's like, hey, give me leads, I'm ready, willing, and able to go ahead and take care of this client as soon as possible, um, they will most likely put you in that clicker of people who gets assigned a lead, right? And so you want to keep checking your emails. And then when you see that lead, go ahead and accept it and call that person, right? Those are basically free consent to contact cards, right? Those are people who have said, yes, I want more information on a Cigna healthcare plan. Now, do I vary on how I do my presentation? No. I still go through pages 1 through 4. I still make sure that I find a plan that best aligns with them. And so when you find a company like Cigna, and most of the companies are set up this way, where they assign you a lead, you're going to have to report what happens to that lead. So if it's sold under a different company because needs were better met there, you simply just put that, right? So again, we started already covering two big things that help us in rest of year just by having a good relationship with our broker manager. One is they do seminars, right? They create those seminars. Sometimes, actually probably more than sometimes, a lot of times, what will happen is they will look to you for suggestions, right? Do you know your community? Do you know where your nearest 65 or 55 and older community is, right? Maybe we can host a United Healthcare or Humana or a Aetna or a Cigna or whoever presentation in that community. Let them know about all the great things inside of this um, plan, right? And we'll talk to them about that plan. What I normally do from there is I try to sit down with each person individually and talk to them and go through my 4 pages, right? And then I'll get into Sunfire or whatever I do. I like to use books, but I will get a general idea of what plan that they should actually go into, whether it be that plan that I'm representing through that seminar or not. Wherever they end up is where I'm going to end up putting them. So seminars, big thing. Lead generation is the second biggest thing. Another thing that they can do for you is if you have shown yourself to be a go-getter or you have written plans for them, or just being a new agent, and you're trying to take the right steps, which would include reaching out to them, introducing yourself, trying to meet with them, maybe doing like they like to do like these sit and greets or uh, what do they call it? Coffee and whatever, which is like a 20-minute sit down with them to get a face-to-face encounter with your broker manager. Highly encourage you to do that, right? Because it already puts you in line for the first two things I talked about, but it also allow you to grab some materials from them, right? So some of those freebies that I talked about for the seminar, you can ask for some of that stuff at the meet and greet. You can also talk to them about different strategies that they use as a company to go into neighborhoods, what kind of marketing materials work and what kind don't work in your specific area, right? And so what you'll find is your broker area manager is kind of like a me, except they're for a specific product. And because I am just in one place, I don't know what the plans look like everywhere, right? Um, you can definitely get a lot of information from them about specifics that are unique to the areas that you are marketing in, which might put that company above every other company in that area, and you might not realize it. Like, for example, in Florida, where I do a lot of business, Cigna, the way they do their dental and their vision is very unique compared to all the other companies. And so when I look for somebody who, when everything else is pretty much even, and they talk very much about, I really need dental work done, or I really need to go to this specific dentist, um, I look very closely at Cigna because what they do is they say, hey, you know what? You can go to any dentist you want to. And what you'll end up doing is paying the bill, and then we're going to reimburse you up to this amount of dollars, right? Whereas most other companies will just say, well, you have $2,000 worth of benefit, but you have to stay within the network of doctors that we already have contracts with, right? So when I have a situation like that, it makes a lot of sense to go with Cigna because they already have a dentist in mind they want to go to, right? And again, a broker manager will be able to tell you about things like that inside of their plans that make them special. Humana is really good about that. They have some very unique products that offer some pretty unique benefits. Um, Life 360 or 365, I think it's called, um, is where it's a whole model of how to keep that client healthy. So there's a reward system built into that. There's some monitoring built into that. There's all kinds of things built into it that makes it unique, right? Versus other companies. Something unique to United Healthcare is they have what they call a passport program for a lot of their PPO products, which means that they can literally take their benefit package from where they're at, move it to a different part of the country that they're going to be visiting for up to 9 months and have, let's say, Florida benefits in Texas, which may be a lot richer than what a Texas benefit, excuse me, would offer. So again, broker managers are out there to help you to do the best that you can do during this time of year. What else can they do? Well, a lot of them have relationships with doctors. So I don't know how long you guys have been listening to me. I see some names on here have been here for a long time. I see a few names on here I don't even recognize. So no matter where you're at, right? Having that relationship with your broker manager can allow you to break into some areas that you may not be able to do yourself. Sometimes when you walk into a doctor's office, you could be the nicest person in the world. You could bring them coffee and donuts for 3 or 4 weeks in a row, and you might not be making any headway. But if you walk in there with a representative from, let's say, Aetna, and Aetna says, hey, I just wanted to let you guys know this is one of our reps, blah, 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 right? That has a little bit more tout to it than sometimes the efforts that we do by ourselves. So what is this call really about? If I could put it in just a couple of words, I would say lean very heavily on your broker managers right now, because your broker managers really could be the difference between writing just a couple of policies a month versus 40 or 50 policies in a month, depending on how much you lean on that relationship, right? So that's really for this week. What I really want to get across to you is use your broker managers. I am very good at the sales process, but I don't know your areas specifically. I don't know any of your doctor's offices specifically, except for a couple of you in Florida. I don't know some of your plan specifics, right? And what makes the products for certain companies unique in your area. And the broker manager that is assigned to you will have all of those answers. And if they're a good broker manager, they will understand that helping you helps them, because at the end of the day, they will get paid based on your performance, whether good or bad, right? So if you don't have good performance, guess what? It looks bad on them, especially if you reach out. So my advice for this time of year, my main piece of advice is to lean on your broker managers. They can be very, very, very good for you. Okay, let me get into a question here. Let's see. I'm doing an online meeting on Friday with UHC. Our broker manager is 2 hours away, so this is a good option. Yeah, that's not a bad thing to do either. As long as you've got contact. Sometimes it doesn't have to be face to face. I am a big proponent of trying to do things face to face, whether it be on the client side or the broker manager side, especially with the doctors that we try to form our relationship with, right? But when that's not really an option, like a 2 hour drive is pretty far to go for a cup of coffee and a few free items, right? So when we have other options available to us, as long as we are trying and we can show them that, hey, look, I'm out here, I'm ready to work, I'm wanting to work, I'm wanting to do things for your company, they will be reciprocal to you, right? They will come back to you and say, hey, this is what I can do. This is where my strengths are, right? I can put you in contact with this doctor's office, or I can give you these freebies, or I have this lead system that we use. Any of those things, right? The other thing, which I don't always like to mention too much, But the other thing that a lot of broker managers have access to is on a quarterly basis, they have access to marketing funds to help you to generate leads, right? Sometimes they do that in a co-op where they do a 50-50 with you. Sometimes they just give you a flat out amount of money that you can spend within their stores or what have you. But regardless, it is money that you can use to help generate business on the Medicare side. Yeah, hopefully that makes sense, right? Hopefully I'm saying that in a way that's pretty clear. So what can a broker manager do that I can't? Well, a lot of things, right? And as good as I am, right, doing this 20 plus years, I am not the end all be all. And I will say this, for those of you who are not tracking, CMS likes to do a review pretty much every year. Like, how are things going? Have there been any things in the market that have made it so that things are not fair, or has made it so that seniors are bullied or not treated properly or anything like that. So we are currently awaiting a response from CMS for the changes that will affect the 2025 year, which technically start October 1st of this year, right? Going in for AEP 2025, right? Which will start October 1st, so to speak, 2024. So that will come out very soon. So what I will say is this, from what I am reading, it looks like some of the bigger companies are probably going to be most affected by the rulings that CMS is coming out with. So they're coming out with some rulings that are limiting some of the dollars that can be spent as far as marketing. But keep in mind that that doesn't start until October of 2024. So they still have all of their Q2, Q3, Q4, because Q4 will actually be from July, August, September. That will be Q4 on the Medicare year, right? So they still have at least 2 quarters worth of marketing funds that have already been allocated to your areas, right? And so why should we not take advantage of those, right? Whether it be through freebies and gifts or through marketing dollars or any other thing that the broker manager can offer to you. So net, broker managers, super important people, right? Most of us blow them off. Like, damn it, another email from this guy. Quit sending me emails. Pay attention to those. Those are important, right? Those are very important people. And sometimes when you've been around as long as me, I have a tendency to not pay attention as much, but they do send out a lot of great information, especially if you're new. And because of the things that they can do for you, especially for the newer agents, I'm recommending that you look to try to build relationships with them as close and tight as possible right now. People who do very well in the Medicare industry, and I'm guilty of this sometimes, will look at AEP and OEP and say, you know what, I just busted my butt for 6 months. I'm going to take some time off. Guess what? That opens up the field for everybody else, right? All the new people saying, hey, I want to make some sales, right? So definitely go after that. Go after those relationships with those broker managers and say, hey, look, I'm here. I'm already trained. I know how to sell Medicare, right? I just need people to get in front of, places that I can possibly work. Sometimes they'll set up a booth for you inside of a store or a kiosk or something like that. There's lots of things that they could possibly do for you. And so I highly, 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 can't say highly enough, recommend that you look to try to build and strengthen those relationships with your broker managers for every single company that you have. So let me pick on some people here. Connie, you're in Central West Florida, correct? So I believe you have 14 carriers that are in your area.
Sounds
If
about
I'm
right.
not mistaken. I know I'm got to be close, right? Because there's Freedom, there's Devoted, there's Optum, there's United, Aetna, Cigna, Humana, blah, 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 blah. If just one of those broker managers were to help you, you will get sales from it. But if all of them help you, think about that, right?
Mhm.
You just got one sale from each of those carriers a month. I mean, that's one every other day, right? That's 14 sales a month,
Mhm.
right? So I'm hoping that I'm trying to like broadcast why this is so important, right? And so it's very normal for carriers, and when I say carriers, that's any company, to want to do things like seminars. And when they do a seminar, they do it right. They do a broadcast that will come out um, plenty in plenty enough time for people to come out. A lot of times they will say that there will be some kind of promotional items given away or things like that. So there's a big draw to come in, right? And especially if they're doing like a turning 65 event, right? Um, and so why not take advantage of those things, right? Those are great things to have. And it doesn't cost you guys anything. Notice, if you guys notice, if you've been listening to me for a while, you notice that I try not to spend any of your money, right? Money that you earn, I want you to keep, put it in your pocket, right? Let the broker manager spend their money to make you money. Because at the end of the day, if you sell products for them, you're making them money as well. So the better you do, the more that you say, hey, yeah, I'm available for a seminar. Hey, yeah, I'd like to do a clinic with these other companies or whatever. The more they will be willing to put you on that higher list, right, of first to call. So let's see. Tuma, I'm in Georgia. How do I know who my broker manager is? Who do I contact? Okay, so assuming that everybody on this call is contracted, which if you're not contracted, probably shouldn't be on this call, but that's okay. Once you are contracted, um, you should be receiving emails from different companies. Matter of fact, I'm going to try to, let me see if I have I get a lot of emails. Let me see if I can pull up one real quick. Okay, can you guys all see my email? Thumbs up from Cheryl. Okay, so okay, so this guy just sends out, hey, this is emergency declaration sent to us yesterday evening. It's impacting all counties and these contracts for basically these plants, right? See how he sends his card? It's got like a little QR code scanner, a mobile number, and his email. Uh-oh, what did I do? I clicked on it. So people like that are people who know how to do their job, right? Now you should have that probably for everybody. the email that I was in, I don't have all my accounts through. So this is actually just an older one, but this is a recent email. This one just came out 3/22. So what would I do with this? Well, I could email them, or I could just give them a call. Say, hey, Randy, my name's Carl Judd. Look, we're in rest of year right now. I really want some help on trying to sell some of your product, right? Let's have a conversation and take 20 or 30 minutes just having a conversation with your broker manager for your area, right? And Connie, I think that might be your same broker manager for your area for Cigna. So a lot of times they will be labeled Humana, Aetna, Cigna, whatever company. But if you can't find who that is, you can always go through Spark, right? And call Spark and say, hey, look, I'm in, I don't know, Kim, where are you at? I know you're in Texas somewhere.
Dallas, Texas.
Okay,
And I get like 10 of these a week.
Right. So, hey, United Healthcare, I'm in Dallas, Texas. Can you tell me who my broker manager is? And they might say, well, you're in a big area. You actually have 2 or 3 of them, right? If you're out in the middle of the sticks, they're going to say, well, you have 1, right? But they will give you the names and the contact information for those broker managers. So you could just simply call Spark and say, hey, look, I'm looking for the broker manager for my area for basically every plan that I'm contracted with, right? And they will help you to get that information. And like I said, I highly encourage you to do that this time of year because that will jumpstart things for you. Now, for those of you who have been listening to me for a while, and I have been talking about marketing through OEP and the rest of the year, now is also the time maybe to get your broker managers involved in what you've been doing, right? Hey, I've been talking to this assisted living facility, right? And I'm trying to figure out a way where I can host some kind of seminar or a Medicare 101 or something like that, so I can become a greater presence inside this facility. They love having conversations like that, right? Because they want their product to shine and they will do as much as they can for you. Or if you happen to know that you have, senior centers, or if you have, cheap buffet places where they can host any of these seminars, right? They want to lean on you. And so you're going to have to know your area a little bit, but they want to be able to provide you with all the tools that you can use for their products. Now, that will also include maybe even some education on their websites, right? So I know a lot of us, we lean very heavily on the Sunfire platform to do a lot of the work for us, right? But every carrier actually has their own website. So for example, United Healthcare, they have Jarvis, right? Humana has its own website. Aetna has its own website. Cigna has its own website. And they have tools and marketing materials, all kinds of stuff that you might not know that you have access to, that can help you to generate more business. So again, yet another reason to lean on these broker managers and just spend some time with them, right? When you find that you've got an hour of nothing to do, call them up, right? Say, hey, this is who I am. This is what I'm trying to do. How do I get myself moving from here, right? and just open up that conversation with them. And I think that will do a lot of you very well. Because again, Medicare is a pretty lucrative business once you've been in it for a couple of years, right? So for those of you that have seen like the big picture, right? You get downlines, you get all this stuff, and you start seeing how much money there really is in Medicare. There's a lot of people who will only work the 3 months a year, right? Just the AEP portion. But most agents only work 6 months and then they're done. So this is an ideal time for those of you who are newer to Medicare to really grab the attention of your broker managers and to get some quality time with them and get your name so that you're one of the first people that they think of when they have a lead or they have a promotion or they have a seminar or whatever, right? So really this call, I wanted to make sure that I really helped you guys understand the importance of having that relationship with your broker managers for every carrier that you represent. And if you only have 1 or 2 carriers, you definitely should think about trying to expand that, because like I was mentioning with Connie, the more people that you have that will help you, the better, right? It just makes sense. So with that, let me see if I have any questions here. Let me go up here. Okay, so Kim, that's a great idea because I'm not a master of any of the carrier websites. Yeah, Kim, they will definitely help you with the websites for sure. Sarah Jane. You also see me join these trainings. Sarah Jane, can you come off of your mute for a second so I can talk to you?
Yeah.
Okay. Are you not getting the invites to our, like, how did you get to this training?
Tuma sent it to me, my sister.
Okay, so you are not registered with the LBA website, correct?
I guess not. I thought I
Okay.
was, but
So that sounds like that needs to be fixed. So what I would recommend is send an email to support@legacybenefitalliance.com
okay.
and just say, I'm not getting emails. I'm not sure if I'm set up with the LBA website or not. Can somebody please look into this for me? And then we will get somebody to respond back to you on that. Once
Okay.
you're set up with the LBA website, you should be getting these automatically.
Okay. Thank you.
Okay, sure. Okay, so as I promised at the end of last year and the beginning of this year, trying to be more cognizant of time, I have left myself 9 minutes for questions and comments and concerns and all these other things. So shoot them at me. And you can text them or you can come off your mute and just ask them, either way.
I got a question.
Okay?
Hi, this is Tuma. I know I put in there asking about broker manager. How do I come across, how do I find out who my broker manager is? I did register with Aetna and Humana in United. And I already been certified with Aetna, not Humana in United yet. But my issue here is I get all these different emails and I don't even know exactly what to do. Who do I contact for help?
Okay, worst case scenario, right? Let's just say you're getting bombarded by emails from all the different carriers, right?
Mhm.
And they can be generic emails because sometimes they're generic, sometimes they're from a specific person. you could try it one of two ways. You can go through your email and search like Humana or Aetna or whatever. Or what would probably be most efficient would be to contact Spark. And so you're looking for the product manager for your area, right? So Tuma, where are you located at?
I'm in Georgia,
Okay, we're in Georgia,
Atlanta.
Atlanta. So just call Spark and say, hey, I'm in Atlanta, Georgia. I'm contracted with 1, 2, 3 companies. Can you please give me the broker manager for those 3 companies? And they'd be
Okay.
happy to do that. They have that information pretty much at their fingertips.
Okay,
So
thank you.
it'd be easy for them to get that to you.
Okay, great. Thank you so much.
Sure. And Zoe, I see you have your hand raised. Go ahead.
Yes, hi. Can you hear me okay?
I can.
Okay, good. I just wanted to tell you it was successful. Remember a while back where my dentist said, I want you to be contracted with a certain plan to help my patients. And I just wanted to let you know that I wrote 2 applications last week with some referrals from him. And so it really helps to build a relationship with, with people like your dentist or your health, because then that helps to get referrals too from them. And also I had a question about, does anybody know if the Humana clients get a separate spendable card when they have for the over-the-counter benefits?
So that depends on the area they're in.
Okay,
And what a great question to ask your Humana broker manager.
that's what I was thinking
Right?
about doing. Yes,
Right.
okay.
And
thought so.
and so I could probably go to like Medicare.gov, or I can go through Sunfire and look it up and go into the plan details in the summary of benefits, and it would
Mhm.
tell you. But
Okay,
instead of taking all the time to do that, which would take you 15 to 20 minutes anyway, why
yes,
not just pick up the phone and call the broker manager and say, hey, my name's Zoe. I'm contracted with your company. I've got a quick question for you to begin with, but then I want to introduce myself and see how well we can start working together, because I'd really like to start picking up my business and start making you look better by selling
okay,
your product, right?
good deal.
So instead of giving you the easy path, which would be just to go to the summary benefit and look it up, I would push you to the broker manager so that you can start building that relationship a little deeper.
Okay, all right, thanks.
Sure.
Thanks, Carl. Good to be on today. Thank you.
Okay, other questions, comments, concerns, thoughts? Nothing. Man, I tell you what, you guys make me feel like I'm a superstar. I know I've been doing this for a long time, but it's very rare that I don't have questions when I get done with training. So maybe it's different when we're in person.
I think it's because we all know that we need to do better on this, and none of us want to admit to it.
Yeah. I love it when people are honest. Well, with that being said, if you don't take anything else away from today's training, which I didn't really train you on anything, I just kind of talked to you, right? And it's kind of how I do my trainings. Talk to your broker managers, right? That is what they're there for. They get paid, and this is the honest truth. They get paid to help you succeed. And so if that means sitting down with you for 30 minutes or an hour and finding where your strengths are and finding a way to get business in front of you, there's nothing wrong with that, right? we all have needs in our business, right? We all have needs on how to create more business. Medicare this time of year doesn't have to take a ridiculous amount of your time, but it still requires effort. Medicare never requires zero effort, right? It always requires some effort. And so if that effort right now is reaching out to your broker manager and trying to get on their good side and formulating a plan on how to get you better in their mix, that might be all you need to do, right? Along with writing some business. But Kim, I appreciate you saying that, because even myself, I can do better, right? I could probably give you guys all kinds of different stuff and have you have full access to it. But I really enjoy watching an agent get to the point where kind of that light bulb clicks and it's like, okay, this is how this works. These are the resources that I use. This is the pathway to get the most leads or whatever. So I lead you to those areas. And whether you act on them or not is up to you. And I think however much business that you write is probably a reflection of how much effort that you put into that. So I hope that today's training helps motivate you to get in contact with your broker managers, because yes, they are the ones that will help you the most this time of year. I'm always here, especially via text, to help you through a sales situation. But if you don't get to a sales situation, the most I can do is try to train you, right? Where a broker manager, they really have a lot more access to try to get you in front of people. And that's what you need right now, right? Is you need to get in front of people so that you can write sales. So what else do we have here? Tuma, thank you for those nice words. No more questions? All right. Well, as promised, I'm going to be better on time. So it is now 6:30. And if nobody else, I see Zoe, you still have a hand raised. I'm not sure if that's from prior or for now, but
Well, I didn't realize I didn't lower it down, but I'm sorry. I just wanted to say that when I did have my broker manager contacted me when I was got new contractor with a new carrier. She spent a whole hour Zoom call with me, showing me the site and everything. And she even told me, if you need help closing a sale, I'm here for you. And she gave me her cell number and if I have a question. And so you're right. It does pay to make a connection with that.
yeah, absolutely. Absolutely. So for those of you that are looking for ways to make sales, reach out to those broker managers, right? They have more leads than I do for you. You guys are spread out all across everywhere. And so I don't know half of your areas. I don't know half of the products that are out there. But what I can do is I can point you in the right direction, right? And so like I just said, I can point you to the right place, but I can't make you do anything, right? So if you want to be successful in Medicare, for this time of year, the best thing that you can do is reach out to your broker managers and take advantage of the services and the different things that they can provide to you. With that being said, 6:32, which is just a couple minutes shy of a full hour's worth of training. I'm going to go ahead and say, if nobody else has any questions or comments, that we'll go ahead and wrap up for today so that I can get this over to Mike and we can get this put into the save files so that if you need to rewatch anything or what have you, it'll be in the recorded section where we keep our Zoom trainings. All right. Well, everybody, thank you for joining today. Hopefully you got some good nuggets from this. And we will have training again next week at the same time, 5:30. And will be a different topic. So we will see you then.